Hello and welcome to the Third Sector. I'm your host, Tamara Brinkman. In our society, there are three sectors: the public, the private, and the nonprofit. And it's that third sector that we're here to talk about today. Joining me for today's episode, I have Shepard and Andrew Hoover from Reid's Community Health Department joining us. And so welcome to the Third Sector.
Thank you for having us.
Well, we're very happy to have you. Andrew and Ashley are here to talk to us today about this newly formed department to answer some big community needs, and it's called Community Health. And so with that, I am going to turn it over to you guys to sort of tell us why there is this department, how long has it been around, and how did it come to be? There's a lot of questions in one, but I figure you guys can sort of,
So I think the need for the department is not everybody has access to healthcare or equal access to healthcare, or they just don't know all the resources that are available to them in the community. Mm-hmm. So for us, that is the goal, is to provide those resources to everybody. Mm-hmm. And Andrew can go a little more into how the department came to be.
Mm-hmm. Yeah, so the Reid Community Health Department is very unique. It is actually funded through Health First Indiana, which is a large public health initiative through the state of Indiana. They are basically mini grants that were given to all 92 counties in the state of Indiana. And we're talking millions of dollars. Wayne County did receive funds.
Okay.
And each health department kind of approached it differently. Some health departments took on their own initiatives, and some leased out or had grant cycles for other organizations to kind of take part in some of those public health initiatives, and that's what Wayne County did. Mm-hmm. Reid was identified as one of those partners, and that's how we came about. So Reid applied for the grant funding to basically create our positions. Both the Wayne County Health Department, Reid, and the state of Indiana worked to create what would be the pillars of our department and what was needed most. And so our department is completely grant funded. The department started in literally the beginning of September of 2024.
Okay.
I started right immediately, as well as our director, Jess Sheebish. Mm-hmm. And then Ashley started in October, and we are moving fast. We'll have another person starting here in about a couple weeks.
Oh, wow.
So that's exciting. We're adding a third person.
Great.
Very much needed.
we're very excited. It's been moving fast, but we've heard a lot of positive feedback from community partners. Because it places more people from Reid out in the community, hearing what the community needs, and being able to take those problems back and address them, but also just help people navigate through resources and healthcare in the community.
Okay. So tell us a little bit more about what are the issues you're hearing from in the community when you're going out there. What is it? 5 things, 20 things, 3 things? What are you hearing about that seem to bubble up?
So our main focuses are chronic disease prevention. So just teaching people about blood pressure, diabetes, things like that. Mm-hmm. And then trauma and injury prevention, which that's kind of Andrew's cake and butter. He loves the car seat, car safety, safe sleep, teaching safe sleep classes. We provide free pack and plays, free car seats to those who need it. Everything we do is free.
Fall prevention and seniors.
Fall prevention.
Also falls under, that's a huge area. That falls under trauma and injury prevention as well.
Yep.
So, I mean, this is a little bit off the page, but how do you do fall prevention? I mean, honestly, because I trip and fall, I lose my balance. I have to work on that all the time. I mean, it's, and as you age, obviously it gets harder. So what does that look like for?
Yeah, so fall prevention, there's a couple different ways. One, obviously if you notice you have issues, talking to your provider about it. But also we're able to lead what we call learn-togethers, which are classes at different organizations to talk about issues. But also we can do home visits. We can talk with people about identifying areas in your home. So whether it's a handout or something, looking for cords in your house. As we get older, it may not be the best idea to be wearing the cute sandals and stuff anymore. Maybe we need a nice steady tennis shoe. But just making sure, and also as we get older, making sure that we stay active is very important. Because the more we're not active, the more the body just isn't ready for it. So learning and doing quick exercises while you're at home, especially as you get older. But then also a lot of our department's free, but there are areas to where if somebody needs help, hopefully we can navigate them towards. Reid has fall prevention specialists that can work with people one-on-one or group classes, but then also maybe it's connecting them and getting them resources for their house, whether it's some night lights or some grabbers or helping them identify what's helping them fall.
Okay.
And then the third main focus of our department is tobacco cessation, and that involves smoking, vaping, chewing, all of those things, which that's really taking off right now, and that's one of the things that we'll be talking a lot about today.
Okay. All right.
Yep.
Well, continue along. Tell us about the smoking,
The smoking
smoking,
program?
vaping. I mean, there's so many things now. It used to just be don't smoke.
Right.
So I'll let you tell us.
Yeah, there's smoking, vaping, chew, there's the new Zen pouches. So we both got certified through Freedom from Smoking, which is through the American Lung Association.
Okay.
And those courses are completely free to everybody. There are incentives for doing the courses. It is a 7-week, 8-session course. And that 8th session comes in on quit week. Quit week is week 4. So up to that 4th week, what we do is we find out your triggers, find out your smoking patterns, find ways to avoid, alter those patterns, and then find alternatives for them, and also come up with a plan to go around the concerns of quitting, because when people quit, they worry about gaining weight, they worry about their social circles changing, so just finding ways to do those things. So on that 4th week, we ask them to quit, and then 48 hours later, we have another session for more support, because you've hopefully quit for those 2 weeks, and then we just continue building their personal quit plan. And then the 8th week, we have a party, a celebration for them quitting, and and we do realize that it takes people multiple times to quit. You know, it's not a failure thing. It is, we look at it as like you're practicing. Like you do it the first time, you're practicing for when it actually sticks, and sometimes it takes more than one time. So this program, while it is free, you can do it as many times as you want, as many times as it takes. Like, so we're really looking forward to it. Right now, we're doing classes at Reid. We still have spots open if anybody's interested in coming. And then we will be partnering with another area business to hold classes on the opposite side of town at different times. And then we are looking to add like evening classes, because we do realize that is a huge need. People work, they want the later evening classes, so we are working on doing that as well.
Okay.
And that's the really cool thing about the program is it is very adaptable, and it will grow and move as we grow and what we hear from different community members. But the coolest thing too is this is something that hasn't been in Wayne County for over a decade with cessation programs, and typically cessation programs range between $60 to $120 a person. And this is the only one that we know of in Wayne County currently, and it's completely free.
Right.
So we're very excited to be able to bring that to the community.
Yeah. So I was just going to ask, if somebody's listening to this and hearing this and they've been on the bubble, they're like, I kind of really want to, or may have an underlying health condition because they go together. How would they connect to find out about the classes or the upcoming opportunities or where you're at?
So we've put flyers out in the community. I think it'll show on air here, but you can reach out to us through our email, which is community.health@reid.org. I'm always getting confused.
We're putting a graphic up for the folks. So there we go. So then
you can go to reidhealth.org/quit. That's really simple.
Okay.
Those are 2 simple ways to get a hold of us. And once you fill that out, the registration form, it's kind of like a pre-registration. It doesn't automatically register you for class, but it gives us a chance to call you. We like to have conversations with everybody to kind of figure out where they are in their journey, and then we try to figure out what class might work best for them.
Oh, nice. Okay.
And I will say, if classes are full, which they're not now, we've just started, so they are still filling up. But if in the future class is full, we do connect people with resources in the meantime before that next class would start that they're able to start.
Right.
One of those being Quit Now Indiana. We know the state has poured a lot of money into that. It has revamped, so we are working with them as well, providing that resource. And then also Andrew is teaching Catch, which is more aimed towards kids in school. It's a school-based program, so
Okay.
I'll let him talk a little bit more about that.
All right.
Yeah, so Catch is it's a global program. It's called Catch My Breath. It's a vaping prevention program that I've become certified in to teach in classrooms, grades 5 through 12. But also I can teach other educators and other groups how to teach it. So we're actually working
Yes.
with some local schools now about bringing this curriculum in for either this year or the next school year, but then also working with some other nonprofit partners that work in the community with children to just prevent vaping. Vaping is kind of outgrowing tobacco now.
Wow.
And a lot of people look at it as the safer option, which is not at all what it is. It has its own dangers. And unfortunately, there's a lot of parents who let their children vape because they think that it is okay. And our goal is to not only educate kids, but also educate parents. So we're able to have discussions with parents as well of why vaping is not great,
Right.
and why we should not allow our children to vape.
And a
So,
lot of times, parents may not realize that their children are vaping because vapes are not made to look like vapes. They are made to look like highlighters. They are made to look like pens. All little USB drives. They smell good, so you don't smell that tobacco. Maybe you think it's a perfume. Like a lot of parents just don't know. So I think one of the things Andrew's looking to do is hold those classes for parents just to educate them on what vapes look like, what they smell like, what they are and what they are not. So
Right.
yeah, that's very important because vaping is a huge issue. Vaping and the Zen pouches.
So the Zen pouch, that's I assume it's effectively like it's
It-
chew in a
yeah,
pouch
it's
or
like a little
something like
nicotine. Yeah, it's basically like nicotine in a pouch. You just kind of put it in your lip and you know, it does its
Absorb the
business, gives you the
nicotine and-
nicotine, and then you spit it out when you're
right.
done.
Yes.
So you're just not inhaling
Yeah.
the carcinogens that
Yeah.
come from the
We
cigarette.
actually
per se,
talked with
but-
the area school, and they were telling us that they are finding kids that are having medical emergencies from vaping and doing the Zen pouches. So they're getting double dose of nicotine, and it's causing them to get sick. So it is a very,
Oh, because
very
they're combining the
yes,
two.
yep.
Oh, wow. Okay.
Yeah, it is a huge concern and something that we are really hoping to be able to address within the schools to help
Yeah.
them fight the issue because it's a big issue.
I wonder how many of our kids across the county are.
And they start
using-
young,
Yeah.
like as early as what, third grade?
Third, fourth grade.
Third and fourth grade. Oh my goodness.
So I know some area partners have other programs besides Catch that they have in the schools for middle school and high school. And we're looking to also do elementary as well because
Sounds like it's
it's
needed.
needed. So
And that's the key to our department as well, is a lot of collaboration.
yes.
Yes.
So we've collaborated with a lot of nonprofit partners and other businesses that are doing some of the same work. And it's how can we magnify the work that they're doing. So I think that's what makes it so exciting is I've dreamed of something like this being at Reid for quite some time. So the fact that it's here now and we're out in the community, because I think the more people that are out, not just at Reid, but out in the community addressing health issues,
Yeah.
the better. You can't have too many people at the table, in my opinion. So.
No, and it sounds like the great thing is that we know a lot of folks have barriers. One of
Yes.
them can be transportation. So the fact that you have the ability to go to somebody's home, or that you're moving these around in different parts of the county to make it accessible for as many people as possible. I mean, I think that's, certainly removing as many barriers as you can to open that pathway for those that,
And our
need it.
And our partners have been amazing. We had one offer yesterday for us to use their facility in the evening to hold these classes also, which is great because
Right.
everything we do is free. We give incentives for people doing the classes, so we don't want to necessarily have to pay for a place. So for people to offer that,
Nice.
it's
Yeah.
great. Like they see the need for it as well.
Oh, that's wonderful.
And sorry, go ahead. No, I just want to say, like, our program is grant funded, but everything that we are doing is made to stay in the off chance that we do not get refunded grant wise or Reid doesn't pick us up, which we don't foresee that happening. So it's here to stay.
Right.
So I don't want
Good.
people to be like, oh, we're going to start this and then it's going to go away.
Right.
That's not the goal.
Right. Well, that's good to know because
Yeah.
if people are somewhat knowledgeable about grants. They do know that there is an end to when the amount of money
Right.
ends, whether that's or how much the money runs out at some point, right? And so I think understanding that you have that sustainability plan, the
Yes.
plan to keep it around, to continue to offer it, I think that's wonderful to hear that. That's a real level of commitment to the folks in the community by Reid Health,
Yeah.
and obviously the health department in the state of Indiana looking at really trying to tackle some of these big needs.
yeah.
So smoking's one. We talked about that. We also talked about safety and kiddos. You want to talk a little bit
Yeah.
more about that one, Andrew?
Yeah, so one of the other large portions, they come their busy seasons, but we've definitely had the two busiest would be tobacco and then our pediatric safety, baby safety. One of those would be car seats and safe sleep for infants. So in our community, there's, to my guesstimate, less than 10 certified child passenger safety technicians, which is a really long certification. You might see CPST, that's what that is. Also a car seat tech. So there's less than about 10 of those in Wayne County that are actively working. In November, I got my certification, and then Ashley is going to be getting hers here soon. But it's great. We're working with lots of local partners to address this issue. The National Highway Traffic Safety Administration estimates that about 48% of the car seats on the road currently are not installed correctly.
Wow.
Some of that may be that they're not using the right car seat. Maybe it's facing the wrong way. Could be that the seat belt, it's not tightened. And this goes all the way from the pumpkin seats that you come home from the hospital in, all the way up to boosters or even kids that are out of boosters that maybe not ready for that seat belt yet. So that's one of our big issues in helping people, but also supplying people with car seats. We supply people with car seats, no questions asked, because car seats are expensive. So
are.
if you need one, we want to help you get the right one. Maybe we check your car seat. We do that completely free. You can contact us on those same forms that we said. So go to our reidhealth.org/quit. You can find info there. But you can also email us or call us at 935-8830.
Okay.
And we can check your car seats completely free. We'll come to you, check its safety. If the car seat is not safe in that moment, if it's expired or something, we can give you a brand new car seat.
Oh, wow.
So car seats do expire. It's based on the car seat. Some have different shelf lives than others. If you've ever been in
They
a...
expire.
They do. So the
I'm
plastic...
still in my head, like
Yeah.
going around and around. I'm like,
Yeah.
it seems like it's one of those things like you use it kid to kid,
Yeah.
one to the next, and then you
No.
pass it down to somebody else's. Your girlfriend's having a baby now, and you're like, hey,
No, that
here's
is-
a car
I
seat.
have teenagers, and I never knew they expired for
Yeah.
the longest time. So
So you start to have
Gosh.
things degrade. So like the plastic
Right.
isn't going to work the same way in 10 years.
I guess it makes sense, yeah.
But also one of the things too is if you've ever been in a car accident, you need a new car seat.
yeah,
Car seats are a one-time use when it comes
Okay.
to an accident. That's one reason we try to discourage buying secondhand seats. That is a huge thing. I understand.
Right, because of
You
the
want to get rid of the
cost.
car seat that you
Right.
bought because you can't use it anymore. But if that is something that you're doing, make sure that you 100% know the history of the car seat. In fact, if you're in need of buying a car seat used, give me a call, 935-8830. I will buy you a car seat brand new. Just because you never know the safety.
Yeah.
And your child's safety should be number one.
So if the car's in an accident, even if there's no visible signs to the car seat, you're saying you should be getting a new car seat.
should be getting a new
just
car
because
seat,
of the
yeah.
impact
And
to the vehicle.
That just
and
depends
what it
on,
could-
we don't know
'Cause it could
exactly
be
how that
hidden.
internal working, yeah.
Got it.
So it's definitely important.
I wouldn't have thought about that. I'd think of obviously if it was damaged, you
Right.
got to get a new one. But I wouldn't necessarily think, well, if I got rear-ended,
Yeah.
but the car seat looked fine, I should maybe be looking at getting a new car seat
Yeah.
kind of situation.
And we try to approach car seats in a way to try to get somebody a car seat that's going to last them the longest.
Right. Okay.
So-
convertibles.
Yep.
Convertible car seats, something that will be able to be used frontward, backward, use as a booster. That way
Get
you can use it longer,
Right.
which is important. And another area that we're focusing on with the trauma and injury prevention is safe sleep as well. That is a huge issue across this whole country, but specifically in Indiana,
Yes.
numbers are high. And then specifically,
Very high.
breaking down into Indiana, Wayne County has some high numbers when it comes to safe sleep deaths. So sudden infant deaths, SUIDs, you might see those. Those are related to safe sleep incidents. So promoting safe sleep, which is any child under the age of 1 should never co-sleep. They should practice the ABCs of safe sleep, which is alone, on their back, in a crib on a firm, flat surface. So not sharing bed with mom and dad, having a crib or a bassinet with no blankets, no stuffed animals. Like, baby just needs to be in there by themselves.
No bumpers.
Yeah.
Yeah, see, I think that's one of, not so good, but you put it because you don't want them sticking, they don't want, their hands stuck in between the slats,
Yeah.
but at the same time you get told no bumpers because it could also be really awful.
And bumpers were a thing when my kids were little, so he's like, no bumpers, and I'm pulling up pictures. I'm like, my kids were not safe sleeping
But
at
I think
all.
I relate it to, so safe sleep really, the practice of safe sleep really came about in the mid-90s when we really started focusing on why this was happening.
Right.
The data and the numbers and.
But I think anything with healthcare, whether we're talking car seats or how car seats have changed or
It
safe
evolves.
sleep, not to bring up the pandemic, but it's something we've all lived through in the last 4 or 5 years.
It's a reality.
we remember in the pandemic when new regulations kept coming out. We learned that masks do this, masks don't do this. It's this, it's that. That's a lot of how thing is. We find out more about safe sleep. We find out more about car seats and accident safety, and things change. And that's our goal. So one of the things we do as well is when it comes to safe sleep is providing pack and plays so that you always have a safe place for your baby to sleep. And educating people. We have dioramas that we go out. We actually have a model baby. This sounds horrible, but the baby comes apart in a way to show what happens when a baby spits up, if they're on their stomach versus their stomach, if they're on their back or their stomach. So if a baby is on their back and they spit up, naturally the way the body works is that's going to go up their esophagus and then it's going to come back down and go into the stomach. But if the baby is on their chest sleeping, the way our bodies work naturally, it goes up and it comes back down into the lungs. And that is what
Causes aspiration.
cause aspiration and death.
Wow.
Yeah.
You learn
So,
something
but
new
it's a
every
great
day.
way to show.
Yes.
We've
Right.
bought the tools to show people, because there are people when we go to events, they're like, that's not real. And it's like, let me show you how it works. Because if you don't have an anatomy or medical background, which I don't, I learned all of this, and
Right.
it's you have to be able to show people. And that's one thing that's really important about our department, whether it's teaching safe sleep or tobacco or chronic health and talking diabetes or blood pressure, is it's making things equitable and making sure that people understand their health journey, being able to get their questions answered. And the great part is if we don't have the answers, we will get you the answers. We will either ask the experts. We have content experts from the hospital and throughout the community that come and speak with us. Maybe it's a doctor or a dietitian or an exercise specialist.
Fall prevention specialists.
Yeah. So.
Okay.
And I will say, with the pack and plays in the car seats, it is not just for mom. If mom and dad live separately, have different cars, we provide car seats for both. If grandma watches the kid and she doesn't have a safe place for the baby to sleep, we can provide a pack and play for that.
Oh,
so it is
wow.
not just for the mom or the parents. So whoever is
it.
watching your kid, whether it be your babysitter, we don't want them laying on a bed. We don't want them laying on a couch. We will
Right.
give you a pack and play so they have a safe place to sleep.
And
Okay.
we don't, like I said, we don't ask questions on that.
Nope.
If you have a car seat already, I'd like to look at the car seat and make sure that you don't need a new one. But there's been times where we've had parents who, for whatever reason, we don't judge. Maybe their children were removed from the home for a period of time, and Child Protective Services says they have to have a brand new car seat to bring their child home, which is completely understandable. But maybe they can't afford it in that moment. It is. I think I can speak for Ashley when I say this too. That's one of my biggest pleasures, is when I'm able to help somebody that may have went through a rough time, and they're so excited to reunite with their child, and we're able to give them a car seat so they can go get their child, and they're so excited and grateful. And like I said, that's where we come in, no judgment. We had somebody call us once. They had been in a car accident. They had 5 children, and they needed 5 brand new car seats because they couldn't, let alone buy one, but 5.
Wow, yeah.
The joy and the graciousness, I think it's just awesome to be able to know that we're helping protect kiddos on the streets and protect lungs throughout our community. I think that's
Yeah.
awesome.
So we have just probably about 3 or 4 minutes left. Time goes so fast. But anyway, tell me, what do you see the next year for your organization looking like? I mean, is it just a continuation of pushing these efforts forward? Is there something where a year from now we're looking to maybe tackle something else, or stay with the core focus right now?
I believe that we will stay with these core focuses, but I'm also hoping to add some more. It's really
Okay.
just going to be our needs assessment is going on
Yes.
currently.
Yes.
I don't know if it will be when this airs. However, it is going on right this second. So that kind of guides us over
Yeah.
the next couple of years. So we'll
Okay.
see when the grant is redone what we add or what we. I don't see taking away anything because
Right.
the things that we're doing, like we haven't really talked about chronic disease prevention, but we were just at Western Wayne Schools. We provided over 430 heart health bags with heart health information. There was like healthy living, healthy activity, fruit pins, like just cool little
wow.
stuff for them. And they were so excited. So getting in the schools doing, because chronic disease prevention isn't going away, tobacco isn't going away, and
Right.
tobacco ultimately affects every organ in your body, so all of it ties together.
True.
But there are some things that I would like to add, and I know Andrew has things that he would like to add,
Okay.
so
So maybe more to come on that.
more to come,
think-
hopefully.
I think, community health is basically another word for public health. Some people may disagree with me when I say that, but things change. So we could see things, like she mentioned, the community health needs assessment might identify new things that we need to look at.
Right.
But the good thing is, too, is while we are tied to these 3 core focuses that we mentioned, we will not turn somebody away. We
Right.
won't. If we can't get you the answer, we're at least going to get you someone. We don't
Yeah.
handle insurance, for instance.
Right.
But if somebody has an insurance question, whether it's Medicaid, Medicare, or even their commercial insurance, because we don't care who you are, what your
Right.
background is to help you, we will at least get you the answers and get you to somebody that can help you. So at the end of the day, if you just have a question about the healthcare system,
Right.
or read, or you just need a resource, we've connected people to clothing and food, and that's not something that we directly work with.
Right.
But we can help people.
Well,
That's our goal.
Food security
you.
is a huge thing for me, so I totally am behind like Gleaners, the food pantries, Circle U,
Right.
those places that provide those resources. We're
Yeah.
at the food pantries helping, passing out information, so
Food is health.
We do a
thank
lot.
you very much for
Yeah.
what you guys are doing. We're going to leave it there today.
Yes.
Lots of great
Yeah.
information. Thank you again to both Andrew and to Ashley for joining us on the Third Sector. Stay well. We'll see you next time.